Now, early on, physician voices were really critical in addressing this issue, and your medical society played a really important role in determining some of the outcomes that have occurred over the course of this year. So this morning, what can I tell you about what has been accomplished and where do we stand after the really extraordinary focus that we have put on this single issue over the course of the last year? Well, one of the most important things that I want you all to feel good about is the fact that we were able to work to ensure that there was a balance between the issue of substance abuse and unintentional opioid overdose deaths, a very critical issue, of course, that needs to be addressed, but also the responsibility that we have as physicians to relieve our patients' pain and suffering. And we wanted to make sure that those things were kept in balance. At the beginning of the conversation, when the governor first began to engage a lot of different constituencies on this a little over a year ago, that conversation was not necessarily as nuanced and balanced as it eventually became. And sometimes we were a little bit of a voice in the wilderness, making sure that our patients' needs were addressed on both sides of this equation, both the need for treatment for pain as well as the need to be aware of identifying patients at risk for and treating patients who were suffering from addiction. So we came to be viewed eventually, I think, by branches of the state government, the press, and the public as really positive contributors to the conversation and the solutions that have evolved to try and address this issue. Nobody can say that the Massachusetts Medical Society has not taken this issue very seriously. Nobody can say that we didn't commit our resources to this fully, both in terms of financial resources as well as personnel resources. And the personnel includes the membership as well as the staff. We put a lot of time and effort into this. Nobody can say that physician expertise was not introduced to the solutions to this problem. And as I said earlier, that expertise was used to balance both the need for treatment of pain and suffering as well as identifying risk of and treatment for addiction. I think all of us in this room can be proud of the fact, as well as those of us not in the room who are members of the medical society or the physician community in general, can be proud of the fact that the medical society's voice was really heard very loudly and clearly on this issue.